Hi guys, today we are going to talk about diabetes. In diabetes, there may be two situations. Number one, we do not have diabetes. Number two, we have diabetes. Well, if we do not have diabetes, then why should we check the glucose level? Well, if I have glucometer at my home, there is no harm if I check my sugar level once in a month. But if I have diabetes, I should be checking the glucose level regularly. So, first of all, what time of the day is best to check the sugar level? Well, as I remember, whenever I go to the laboratory for blood works for diabetes, I am always required to have at least 14 hours of fasting. Why we are required 14 hours of fasting is because whatever we eat, the sugar level jumps up and our body should bring it to the normal within 14 hours. If it does not, that means we have elevated sugar levels and we should consult the doctor. This is how I make my 14 hours of fasting before the sampling. I have my dinner around 7 p.m., which is almost 3 hours before going to bed. And that way, by 9 a.m. in the morning, I check my glucose level. The normal level of glucose is 100 milligram per deciliter. From 100 to 140 milligram per deciliter, it is considered pre-diabetic. We should watch our diet in the pre-diabetic condition. If the sugar level is more than 140 milligram per deciliter, it is diabetic. When I should see the doctor. So how to check the glucose level? For this, we should have the following items. Number 1, alcohol pad. Number 2, lancets. Number 3, lancing device. Number 4, glucometer. And number 5, glucose testing strips. Let us see these items. Let us open the packing of lancets. Here we have approximately 50 lancets. Now let's open the packet containing glucose testing strips. Here we have two containers having 25 glucose testing strips in each. And here is the expiry date. Whenever I buy these glucose testing strips, I always check for these expiry dates. So let me check my sugar level. First of all, I wash my hands in lukewarm water thoroughly. Here is my package that contains alcohol pad, glucometer, glucose testing strips, lancets, and lancing device. First of all, let us insert lancets into the lancing device. There is a slot in the holder of the lancing device and there are ribs on the lancets. So match them and push to insert. Twist the head apart. Here is the setting how deep I want the needle to penetrate. At 0 level, the needle will just penetrate a little. And at level 5, it will penetrate the deepest. I use level 3 for myself. In order to insert the glucose testing strip into the glucometer, I push the tray out, put the testing strip on the tray, and let it be inserted by just letting it go. The blood drop sign has popped up on my glucometer telling me that my machine is ready for the testing. Next, I clean the tip of the finger with the alcohol pad thoroughly and let it dry before finger pricking. Press the finger if required to make it close to a drop of blood. Now we bring the mouth of the glucose testing strip to the drop of blood. The blood will be some sort of sucked into the testing strip. It will take around 10 seconds to process the blood sample. I got 142 milligram per deciliter of sugar in my blood, which is somewhere over and above the pre-diabetic level. It is always better to register the glucose level for the future needs. My glucometer stores previous results with dates and times. Care should be taken to dispose of the used lancets. The needles of lancets are very sharp and can hurt somebody if disposed of inappropriately. It can also transmit any disease. For this purpose, the thickness of the detached head of the lancet is more than the length of the needle, so we can insert the needle into the same detached head like this before disposing it off. So that's it. This is how I check my sugar level. I thank you for your time to watch my video. Thank you.